Hi guys, Dr. Arora here from Arora Medical Education. We're just in the middle of one of our virtual RCA courses and we've done a few telephone consultations, and I do telephone consultation practice for people doing RCA, going back to CSA, PLAB 2 of course at the moment. So one thing I want to talk about is clinical questions in a telephone consultation, because I see people do practice and I see clinical questions done in a variety of different ways. And sometimes there's a lot of things missed out. So the first thing I want to say about the clinical history in a telephone consultation is it's got to be probably more detailed than if someone's sitting in front of you. No question, one thing we often say is no question, no clinical question is too much in a telephone consultation. You can't see anybody. You can't have any visual cues. You can't see if a patient's in pain. You can't see that they're holding their arm. You can't see the fact that they're struggling a little bit to talk. You can't see the position they're sitting in. You can't see anything that gives your brain the ability to ask less questions. When you're sitting face to face with somebody, you see a lot of things and you don't necessarily have to go into detail specifically. Whereas on a telephone consultation, please remember, the more questions you ask, the better. You're basically starting from a blank canvas. You're inventing a picture, but if you don't understand the components of that picture, then what you're seeing in your brain is going to influence you wrongly in terms of how you manage that assessment or that situation clinically. And also, additionally to the fact that more questions need to be asked, the organization or the way that you ask those questions needs to be a little bit tighter than when you're doing a face-to-face consultation. So things like signposting, for example, are really, really important because the other person can't see you. So they can't pick up anything from the way that you're looking or where you're looking or how your hands are moving. So you have to be very clear and explain to them what's going to happen and why it's going to happen. Say, for example, someone calls up and they have problems like, tummy pain, for example, or they've got constipation. No question is too much to ask. So Mr. X, signpost it very well. Mr. X, when it comes to constipation, I'm just going to ask you a couple of things just to figure out what you mean by constipation. So ask every question about the bowels, ask about the bleeding, ask about the weight loss, ask about the tummy pain, ask about the vomiting, ask about, every question that you can see. If someone says they've got pain, get them to describe where it is. Can you, on your tummy, if you can imagine a grid of nine sections, where would your pain be? Rather than just lower tummy pain or on the left side, when someone's sitting in front of you and you say to them, where exactly is the pain? They're going to point to it. Whereas on a telephone consultation, you can't do that. So you've got to be graphic in the way that you describe things. You've got to get them to explain things differently than if they were sitting in front of you. If someone comes up with a rash, you've got to almost get them to paint the picture of the rash. So tell me, what's the color? What does it feel like? How big is the diameter? Is it a rigged edge or is it a clear edge? What is the area surrounding the rash itself looking like? Is it raised? Is it flat? Remember, no question is too much clinically when it comes to a telephone consultation. If it's a child on the phone, signpost clearly. Mrs. X, I'm just going to ask you a few questions about your child's breathing. Number one, get the signpost in so they can start to understand what questions are coming, but then go and ask every single question. If it's a child, ask everything about that question, about that child. No question is too much in a telephone consultation when it comes to clinical questions. How's your child breathing? Are they sucking their chest in and out or not? Can you have a look at their chest? What's their work of breathing like? Are they making any sounds when they breathe? Is there any wheezing, any whistling, any sound when they breathe in, sound when they breathe out? What's the color of their lips? What's the color of their fingers? All these kind of things. When you're seeing somebody in front of you, you can work out a lot of this. You can look at the rate they're breathing. You can see the color of their lips. But on a telephone consultation, you can't see anything. It's a blank canvas. Ask, ask, ask. So when you're doing practice for role plays for an exam and you've got a telephone consultation, PLAB 2, CSA, RCA at the moment, make sure you do two things. Number one, if a question comes to your mind, ask the question. Don't ignore it. Don't think, I'll leave it, it's not important. Because your gut feeling has told you to ask the question. Ask the question. Number two, think about a blank canvas. Start from a blank canvas. Don't imagine anything. Start to ask questions to build up a picture. And number three, as you said, three things. Organize your questions really well. Signpost meticulously when it comes to telephone consultation. Mr. X, I'm just going to ask you a few more things about your tummy pain. Mrs. X, I'm going to ask you a few things specifically about your breathing. Mr. Jones, I'm going to ask you a few things about your child's skin at the moment. Just make sure you, A, ask more than you probably need to. That's the safest thing to do. And B, organize it really well and explain what's happening and why. And C, I should add on, Get patients to describe things to you. Get them to paint a picture. Get them to paint the picture of the rash. Get them to paint the picture of how their breathing is looking. And then you can go and fill in the gaps. One of the commonest things I see when people do telephone consultations is, yes, you've got to focus on ICE and psychosocial and all those other bits of a telephone consult. But the clinical part of your history needs to be 100% watertight, because you have got no visual cues and you can't see anything. So you've got to build up that picture from scratch. We do much more like this on our virtual courses. RCA we're doing right now at the moment, CSA, PLAB 2. Have a look at the website at aroramedicaleducation.co.uk, and we're going to give you 10% off any virtual course or any online course if you watch this video. So if you want an online or a virtual live day course for any exam that we cover on the website, send me an email, aman@aroramedicaleducation.co.uk. I'll send you a code to take 10% off before you book your place. Have a great day. We'll see you soon. You know the hashtag, can pass will pass, hashtag I went with Arora. Take care.